do you feel about being a healthcare professional now? We're actually killing more of our patients than we intend. Well, hopefully, we're not intending to do it at all, but the fact is that we are. And so it's not just leaving chance to whether you get MRSA or you have some sort of complication. These are human errors, and they're often systematic errors. And so as we have different priorities around pricing and number of people we serve and the quality of care, lots of competing issues come together. And so one of the roles of government is to help us figure out what the priorities are, help hold people to task, and then provide some resources. So we're going to take a look at key state roles first, and then we'll talk a little bit more about the federal government, and then we'll end up with state governments again. So public health is a major factor of a state health system, and that is around population health, disease control, prevention, sanitation, environmental protection, even bioterrorism. And this generated from a schism or separation with clinical medicine. So what we do in the hospital system is on the clinical side generally, and what we think about, the county health department, people dealing with breakouts of disease and things like that, that's generally from a public health standpoint. They use slightly different measures. They take different approaches to changing people's behaviors, and it's a big part of what public health, the safety of our communities lies in the public health domain. Along with public health, regulation of facilities and professionals. This is where licensure happens. So those of you who are in licensure programs will need to go through a state test or state accreditation. Not only do they do yours personally, but they also look at what we do here at Altman College and how we teach in the hospital system. And so they work with other accrediting agencies and bodies that help lay down the foundation of what is the minimum qualifications, what are the competencies of professionals, and the facilities they work in. So that's number 2 around state roles. As you're thinking about quality, there is a big question of what is quality, and it is the care from which you blah, 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 blah. So what is quality? Quality is the amount of care and to the degree to which it serves individuals or populations and increases the likelihood of desired health outcomes that are consistent with current professional knowledge. Doesn't mean our quality of care changes over time. We're consistently trying to do the right thing with the best knowledge we have. But it's going to look different if you look 50 years ago or you're going to look 50 years ahead. So quality is something that we do right now, and it's about doing the right thing at the right time. So keep that in mind. Again, trying to understand what the role of the state is there for. So regulation of insurance and HMOs. So HMOs are the management organizations for health insurance. So the state looks at solvency. Do they have enough money to do what they need to do? If something happens or a large group of people get sick, can an insurance company, actually pay out the money that they say they can? So again, that's going to be about quality. They're also looking at consumer protection. The government has, essentially a compelling concern that all of the consumers, you and me, are protected from quacks, scam artists, firms that just want to sue and get money out of the system, as opposed to helping you. Medicare is the major medical insurance group, right, that the state also has to work with. They also work with medical schools and how do they finance and strategically promote health around the entire state. So you'll see this in some hospital pieces in the future. So health force work education, like I just mentioned, with Altman College and medical schools, and then how do we financially and fairly manage care when we're dealing with tight budgets. All right, key state roles, number 3. All right, we're moving them forward. So the provisions of financing of health care. The state has a choice to either buy things from different vendors, contractors, or they can actually make it. So they can pay state workers to do different things. You can maybe see the analogy in how they do the roads these days. You might see a state crew out there. That's when they're actually making the roads. But they've also now contracted out to a lot of companies to actually maintain roads. So you can either make or buy as a state official. As we're looking at that, Medicaid is, again, the big 800-pound gorilla in the room. It's about a fee for service, meaning providers get paid for what they do. Medicaid's a gatekeeper in some ways for people to access and what they can or they can't based on sort of these managed programs. So, if you only get so many screenings or you have a certain illness, will it be covered or not be covered? The idea of capitation is the fee that's paid to actual providers for the enrollees. So if an enrollee belongs to a primary care physician, that what they get paid to keep that person healthy is that idea of capitation. The state also manages a very large workforce for state workers and those who are retired from the state, and they provide health insurance there. They're also responsible for the indigent, so public hospitals, clinics, and other places that are uncompensated for the care have to be supported in other ways, and so the state has a responsibility for that. They also are working on health coverage expansion with the ADA. And so people again are looking to the state for leadership on that. They also provide other services. If you look at the MRDD, mental retardation and developmental disabilities in the counties, those are all supported by state dollars. And then the state also has a large buying power over pharmaceuticals, whether that's for emergencies or for the prison system. They have to negotiate and understand the financing and provision for those. All right, and then it's the cost containment. We've asked our legislators, what can government do about the rising cost? And so because of their size and their abilities to do other things, they can look at, what's the best pay for performance? What does it actually cost to do a hip replacement? Or what does it do to cost to treat somebody with asthma? They're looking at those types of things based on evidence-based medicine to figure out what's going to be beneficial for containing costs. And then it's about information dissemination. We have a pretty robust reporting mechanism within the state. So as healthcare providers, you're required to share information with the state on certain things, whether that's directly, incidences of disease or some of the financial pieces that are going on. And so they can figure out who's getting what. All right, and then the health system monitoring piece. It's how do we make sure there's good competition, in a capitalist society, make sure that that system doesn't treat people wrongly or doesn't get too big that it takes advantage of them. So, we as a nonprofit hospital in the Altman Health Foundation, we work in a competitive area. We have to manage our resources and we're trying to do the best we can for the most people, just like the next hospital. And so being able to have a firm and fair playing ground is pretty important. So the idea of federalism allows that the federal government can also empower the state governments. And so here's just a little bit of a timeline about federalism and health policy. So, back when I was a kid in the 70s, there was a lot of discretion that was taken away or held by the federal government. They basically said, here are your responsibilities, state. Go and do with it. And that started to transition in the 80s to having states take on more of the activities that were coordinated federally, and so they were into block grants, and where people or states then had the responsibility to make all this kind of stuff happen. And unfortunately, there's a lot of unfunded mandates from the federal government, perhaps. But at the same time, there's a lot of partnerships, whether that's Medicaid waivers, how HIPAA works, or the child health insurance programs. And so there's a tension, but a partnership between the federal government and the state government. And this is not anything that's new necessarily, but it's something that we need to be aware of as we're thinking about the healthcare system. So take a couple minutes on your Word document and just think about your role in making healthcare policy if you were a state legislator. How does the job of a legislator work? What do you have to be thinking about? Are you just going to be a person who you're just one of us, one of your constituents? Are you just going to go around and solicit advice that's relating to what's happening in our world and our culture? Are you going to be the service provider? Are you going to help us as constituents? Are you going to organize community initiatives? Or maybe you're about acquiring resources. Are you going to take your expertise and knowledge in your prerogatives to obtain resources that are going to be helpful to us as your constituents? Or maybe, expressing policy views and interest. How are you going to do that personally? How are you going to do that to us as your district? What kind of information do you want as a legislator? And where are you going to get that information? So a lot of questions. Think about your approach to healthcare and government, how you think you'd like to be treated as a constituent, and then some of your responsibilities as you think about what was just presented as your role around public health and policy and keeping the system fair. So this should take you a few minutes. I should have some tie back to the presentation and maybe some outside resources to make your position robust and full. All right, we'll be back in a couple minutes.